Okay, now we're moving deeper to the hypodermis, or the subcutaneous tissue, otherwise known as superficial fascia if you're in the dissection lab. And I'm pointing out here that this layer is not formally considered skin, although that's kind of more of an anatomical division per se, because it's connected to the skin, and it's continuous, right, directly under it. And it says directly under all skin, you're going to have a little bit of this layer. Now, I have to say, like for I don't know, the surface of the ear, I'm not really sure if there's a whole lot of adipose tissue underneath that skin. It's really very, very thin. So it's not, I guess, always going to be very prevalent. But around the other parts of the body, this layer of the hypodermis, not skin, but subcutaneous tissue, will even have more formed components in the regards to fibers, and it will make kind of a sheath of connective and elastic fibers, and it might even have special names. And so when you go into the abdomen and you're looking at the difference between the Scarpa's fascia and Camper's fascia, and you go into the perineal region and you're learning about Colles fascia, and you're talking about different tissue that exists, that tissue is existing in this hypodermis region. And so it's not the same all over the body, and some of it has special names, and it's not formally skin, but super, super important. And so it binds loosely to the organs beneath, which is oftentimes muscle, and it binds loosely and allows the muscles underneath to move, expand, and contract, and it shouldn't be attached with any adhesions. Otherwise, that can cause a lot of pain, actually, in your patients. And so it would be this whole layer here, and you can see the transition between this region of the dermis, reticular dermis, that is all fibers, and then you have these big patches of adipose tissue interspersed with fibers and blood vessels, and so this is the hypodermis here. And the hypodermis is going to contain these aggregations of fat, which is called Panaliculus adiposis. That's its formal name, although most of the time you're not only going to hear maybe traditional anatomists refer to that term. And then you can see collagen elastic fibers strewn here throughout the hypodermis in different orientations and directions. And these fibers are the ones that are going to become more oriented and more continuous in certain parts of the body to cause these fascial sheaths with special names. Right here in this particular section, they're not really oriented as one thick layer, and so it's probably not the region of the abdomen. And you can also see the hypodermis, that there are some big blood vessels that are in this region, and that is super important for absorption of drugs. So that's why that this is the region of the skin, or really the subcutaneous under the skin, that you give injections. So you don't normally give an injection down here into the muscle, because that's going to be very painful, and it's also not going to be readily absorbed. The dermis has some blood vessels, but the junction between the dermis and the hypodermis has these big blood vessels here, and that's going to be the region that is going to absorb more drugs and absorb them quicker. And so that's the cool part about the hypodermis. And like I showed you earlier, there are some places in the body. Now I showed you the scrotal sac, and the scrotal sac will contract, and so it does have smooth muscle that is going to exist in this region here of the skin. But in some places of the body, like the face, you're going to have striated muscle that's going to be just within this layer, and that is going to be called the Panaliculus Carnasis, and that is going to allow for you to move the skin on your face into really fine different movements that allow you to do facial expression. So that is an example of a place in the body, and the neck as well is going to have these muscles of facial expression where you might have striated muscle that just deep to this layer. So occasionally you can find that in sections. It's not really a histology section that we see a lot. We usually have kind of hallmark cases of skin that are going to come from places like the back, the palms, the soles of the feet, so you can see a lot of tactile receptors, and you can see thick skin versus thin skin and things like that. So I can look around and see if I can find one from the face. Actually, that would be kind of an interesting scavenger hunt. Okay, so that's really it with the hypodermis. Hopefully you got its main characteristics and importance. So let's just keep going.